recording session and archiving it on our website later. So if your colleagues weren't able to join you today, they'll be able to go to our website, nplan.org, and watch a recording of this webinar at their convenience. So my name is Christine Fry, and I'll be facilitating today's session. This webinar is sponsored by NPLAN, the National Policy and Legal Analysis Network to Prevent Childhood Obesity, which is a program of public health, law, and policy. A few housekeeping notes before we dive in. If you are having technical problems, you can contact Scott Watkins here in our office. He's available in the chat window if you're signed in to the webinar, and he is also available by phone at 510-281-5620. We do recommend if you're having any trouble with the audio to log out of the webinar and log back in before you contact Scott and see if that fixes the problem. If you have any questions for our presenters throughout the webinar, we do encourage you to submit those via the Q&A box, which you'll see on the right-hand side of your screen. We'll have as many questions as we can at the end of the webinar from that Q&A box, so don't be shy. In order to test this out and make sure that you know where the Q&A panel is and that you're familiar with how to use it, we would like you to warm it up for us. So in the Q&A box, tell us how many people are watching the webinar with you today. So just type the number in and hit enter, and you get a feel for how it works. All right, people are getting that. So if you have any questions, and some of you are using the chat box, which is fine, but we prefer if you put the questions in the Q&A box throughout the webinar so we can keep them organized. So you have no excuse to submit any question that you have for the presenters in that Q&A box, and we'll try to get to those at the end of the session. So as I said before, the webinar is being recorded, and you can send your colleagues who missed the webinar to our website, nplan.org, to watch it. It's funded by the Robert Wood Johnson Foundation to provide legal technical assistance to communities that want to use law and policy to create healthier environments. Help model policies and work with advocates and public health officials to understand how the policies might work in their communities. Beverage taxes have the potential to reduce consumption of sugary drinks and create a permanent source of revenue for obesity prevention efforts. Today, we'll explore this public health intervention from a scientific, legal, and policy perspective. We have a great lineup of speakers. First, we'll hear from Kelly Brunell of the Red Center at Yale, who will talk about the public health and scientific aspects of sugar-sweetened beverages and taxes as a prevention policy. Then we'll hear from Ian McLaughlin, who's a staff attorney here at NPLAN, who will talk about legal considerations for sugar-sweetened beverage taxes. And then we're really fortunate to have two folks who have worked on sugar-sweetened beverage tax campaigns. Ann Garcia from New York State will talk about efforts in New York State to pass a sugar-sweetened beverage tax in the last legislative session. And then Nan Filer from Philadelphia will talk about the sugar-sweetened beverage tax proposal in her city. We'll have a Q&A with all the panelists. So without further ado, I'd like to introduce Kelly Brunell, who is a professor in the Department of Epidemiology at Yale University. He also serves as professor of epidemiology and public health and is director of the Red Center for Food Policy and Obesity. Dr. Brunell has advised members of Congress, governors, World Health and Nutrition organizations, and media leaders on issues of nutrition, obesity, and public policy. He had as a moral entrepreneur with special influence on public discourse and a history of the obesity field, and was cited by Time magazine as a leading warrior in the area of nutrition and public policy. So I'm going to pass the presentation over to and get him muted. Looks like he. So Kelly?
Yeah, Christine, thank you for the introduction.
And go ahead.
Okay, thank you. All right, I'd like to provide some background on the issue of taxing sugar-sweetened beverages, and note that the work that we're doing takes part in the Rudd Center for Food Policy and Obesity at Yale University. And the reason I have our address circled on this slide is that we have a variety of excellent resources on food and food policy issues, including a number of things that I'll be discussing later on sugar-sweetened beverage taxes. So please feel free to visit our website. We also have a variety of podcasts that we've recorded with excellent visitors to the Rudd Center, including people like Michael Pollan. So there are things on there besides the resources I'll be talking about today. I begin with a conceptual scheme that we refer to as optimal defaults. Default conditions people are exposed to plays a big role in their behavior, and we see many examples of this. But for example, in a school, if children have access to unhealthy foods, then they're going to eat unhealthy foods, and that's a bad set of defaults. If the school environment is cleaned up and there are only better foods there, then that creates a better set of defaults that affect behavior. And again, many examples of the profound effects of changing defaults. Here's a very interesting one that has to do not with food, but with organ donation. This slide shows the percentage of people in countries to the left of the line in Europe, the left of the white line there, from Denmark, Netherlands, UK, and Germany, the U.S. model for organ donation, where you're not an organ donor by default, but when you get your driver's license, you can agree to be one. On the right side of that white line, you're going to see data from other countries that have a different set of defaults. So there you are an organ donor by default, but you can agree not to be one, or you can opt out of the program. So the consumer choices are the same under both sets of circumstances. You can opt in or opt out. But the number of people who are organ donors varies dramatically depending on what the default is. Those are the numbers when you use the U.S. type of approach, where you're not an organ donor by default. The numbers look this when the default is just changed. So you could try to educate your way from the left-hand set of bars to the right-hand side of the bars, but even at unlimited resources, there's no way you could get to that number, plus you'd use up a lot of money, or you can just change the default. So there's parallels in the food arena that one might take advantage of in order to create public health benefit. So with food, we have a disastrous set of defaults. It almost goes without saying because we have record levels of obesity. What you see on the slides are some examples of this. Very large portion sizes. Healthy food costs more than unhealthy food. There's too much access to bad choices, too little access to the good ones. Marketing is a massive problem. And the one I'll be talking about is liquid calories. The calories people are consuming from liquids has gone way up in the United States, and this has pretty serious implications for a variety of health outcomes. So the question, if you're going to approach something like a tax, which admittedly is a very controversial issue, why pick on soda? And the companies are quick to say that they're only contributing a small number of calories to the overall American diet. They usually use somewhere between 5 and 6% for that number. And there are other things contributing to obesity, which everybody admits is true. So why are you picking on us? Well, here are the reasons we believe soda is a good place to start. First, it's the single, and when I say soda, I'm talking about sugar-sweetened beverages in general, and that will become more clear in a moment, not just the traditional carbonated beverages, the flagship things like Coke and Pepsi. First, the single greatest source of added sugar in the American diet. They're completely empty calories with the exception of gratuitously added things like electrolytes and vitamins. There's calorie compensation. This is a really very interesting issue. The research on this has been quite clear and has been coming out for a number of years now, showing that the body doesn't seem to recognize calories very well when they get delivered in liquids. So say, for example, we took half the people on this call and gave you your traditional lunch, whatever that is, but you got 200 additional calories and they came in solid form. It could be a donut, pizza, or ice cream. And the other half got your traditional lunch, whatever that is, and you got another 200 calories, but it came in sugar-sweetened beverages. And we followed you later on to see if your body intuitively or instinctively made up for that 200-calorie excess by cutting back at subsequent meals. Those of you who took in the calories in solid form would do a better job at making up for them than the people that consume the liquid calories. So the increase in consumption in calories from liquids is a great concern for this reason, not to mention the added sugar. There's the ability that sugar is the nutrient that can best or most trigger an addictive process in the brain. I won't get into this in too much detail, but there's a considerable body of research, both in animal studies and in human ones, suggesting that foods can trigger an addictive process in the brain, much like traditional substances of abuse. They may not have as strong of an effect, but an effect nonetheless. So this is a relevant issue. Next, there's the gratuitous addition of caffeine, which is known to be addictive, and then the amount they get added to a lot of these beverages, they create a clear need or desire in people to keep coming back for more. There's getting of vulnerable populations by some of the companies, and so when the companies say that a tax would be regressive and hurt the poor, they should be challenged for the marketing that they do to those populations. And then second is that there's really no question about the science on this any longer. It hasn't been for a while. The science is quite clear. The better the study, the more likely it is to show proof of harm of heavy consumption of sugar-sweetened beverages. The link with obesity and diabetes is very solid, and there are studies showing links with other health outcomes. There are some studies not showing an association of sugar-sweetened beverages with health outcomes, but chances are that those studies will be funded by the industry. Not all, but most are. So we have a special case of sugar-sweetened beverages entering the American diet. And as I mentioned before, what used to just be the flagship beverages, Coke and Pepsi and 7-Up and the like, been joined by a variety of flavored teas, sports drinks, energy drinks, and other things that give consumers a wide variety of choices of sugar-sweetened beverages. When the industry says that consumption of sugar-sweetened beverages has gone down while obesity has gone up, that's, in my mind, a bit deceptive because they typically are referring to the use of traditional carbonated soft drinks, which have gone down, but they've been replaced by these other sugar beverages. So as far as I know, consumption of calories from sugar-sweetened beverages has been high and has remained high for a long time. You can see the power of the marketing here. The world's most valuable brand is Coca-Cola, and you can think for a moment about how powerful this marketing is. You take Coke and Pepsi, which are pretty indistinguishable products. People are absolutely certain that they're loyal to one brand over another. They're certain they can tell the difference between them when not many people really can, and that shows how powerful the marketing is. The serving sizes have gone up and up and up. When I was a boy, it was an 8-ounce bottle, and now it's much larger than that. Be it in fountain drinks like at the 7-Eleven, and if one buys sugar-sweetened beverages in that double gulp on the right, that is 48 teaspoons of sugar. These products is very effective and relentless, and affects children in a way that develops brand loyalty in them at a very young age. You see what I consider pernicious marketing practices like product placements. At one time, the Coca-Cola glass showed up in front of the American Idol judges. They're still there as far as I know. And the judges change, the number of judges change, but the Coca-Cola glasses remain constant. This is a problem because, and this is a multi-million-dollar exchange between Coca-Cola and the show to have those glasses sitting there. And most, especially children, don't code this as advertising and don't recognize it as such. You see examples like this of things sort of stun people and lead to this belief about what the companies would be willing to do. These are from the 1990s. If you look at the calories per day from milk and soft drinks plotted from the 1970s until more current times, you see that in the 1990s those lines crossed. Most people would agree, most nutritionists would believe that this is not a good public health advance. What are people consuming? Well, the numbers are really pretty amazing when you stop to look at it. The average intake per American is 50 gallons of sugar-sweetened beverages per year. For the girls who use sugar-sweetened beverages, the average is 61 gallons a year. For boys, it's 81 gallons a year, and the average child consumes 175 calories of sugar-sweetened beverages per day. And again, that's the average. Some are consuming none, so the person who is consuming is taking in more than that to even it out. The costs have changed in disproportionate ways. So from 1985 to 2000, Soft drinks went up by only 20% in cost. That's less than the cost of inflation. Sugars and sweets went up by 46%, but fruits and vegetables went by 117%. So in that time, it became relatively harder to eat healthy, given that prices changed in this disproportionate way. So sugar-sweetened beverages start to look like a real bargain, given their low cost and their wide availability and heavy marketing. Frieden, who at the time was the health commissioner of New York City and is now the head of the CDC, and I published a paper in 2009 making the public policy case for taxes on sugared beverages. The idea has been around much longer than that, but it came into the public limelight in 2009 because the prevalence of obesity had finally gotten so severe that public officials were wanting to take dramatic action, and then so the bad economies in the country and in states led to the desire to find a way to raise revenue, and the beverages taxes became a possible means for doing that. We came up with a second paper. This was written with a variety of other authors in the New England Journal of Medicine that provided a more extensive case for taxing sugar-sweetened beverages. And here we left the economic arguments and the public health arguments of using a tax on sugar-sweetened beverages, and I'll talk more about those now. So specifics are a penny per ounce excise tax, penny per ounce on any beverage with added sugar, and that some or all of the revenues would be used for obesity prevention. Ian will be speaking in more detail about the nature and structure of a tax, but this is the fundamental proposal that gets mentioned most often. A penny per ounce tax is estimated by economists to reduce consumption between 10 and 23%. So it certainly doesn't stop consumption of sugar-sweetened beverages, but would reduce it enough to produce health care benefit. And the estimate that initially came from the Congressional Budget Office was a $50 billion health care savings over a 10-year period, and that if it were a national tax, it would generate $150 billion in revenue over a 10-year period. So these are all big numbers, and we get used to big numbers, but with $150 billion, you could really do a lot to help prevent the obesity problem. You could use the money to subsidize fruits and vegetables, for example, or to run obesity prevention programs. Now, the question is, why penny per ounce, and where do we come up with that number? Well, this is a hypothetical tax curve that I've created. I'm not an economist, but this sort of makes sense to me, that you could taxes that up to the top left of this curve that are low taxes where consumption would remain high, and you could increase taxes within that range and really not get any impact on consumption because they're just multiples of a very small number anyway. And finally, you get to the point where the taxes get a little bit larger, and then they would start to affect consumption. And so the current taxes that exist, and they're now small soft drinks or snack food taxes in a number of states, as many as 30, but they're all too small to affect consumption. And in fact, my belief is that they were intentionally created to be too small to affect consumption, so that there wasn't combat with the soda and snack food industry, but they do help raise revenue. So we're talking about a penny per ounce, which would be out in this range, which would be enough to affect consumption, enough to produce public health benefit. This is a slide. It looks it's a little hard to read on my screen, but it's my colleague Tanya Andreeva published an article in the American Journal of Public Health that looked at price elasticities of a variety of food categories. That means that these are foods that what it represents is how much the consumption changes in a given food category as price changes. And so lower numbers here mean things are less elastic. That is, they're less likely to change as price changes, and that's not surprising for something like eggs or milk because people consider those staples and pretty much want them even if the price fluctuates. The bars on the bottom of this, the restaurant foods and soft drinks, are the foods that are most elastic, that is, most responsive to changes in price. So that would be another reason to consider sugar-sweetened beverages as one object of a tax. The industry has responded in a very aggressive way to the proposals of sugar-sweetened beverage taxes. There have been very interesting exposés in the press about lobbying that occurred in Washington and is now occurring at state levels. And so a lot of this is occurring behind the scenes, but the industry makes a series of arguments, two of which I believe are true and are defensible. The others I don't believe are true, and I'd like to go through these quickly. First, three says that many things drive obesity. It's not just soda. Everybody agrees with that, including me. Second, sugar-sweetened beverages won't solve the obesity problem. Again, that's quite true. No one single thing that anybody could ever dream up would totally solve the obesity problem, but that doesn't mean you don't want to start somewhere. I mentioned before they make the argument consumption is down, but obesity is up. That's a little misleading because of what they're referring to as consumption. That sugar isn't special at all, calories are equal. Well, given that sugar might trigger an addictive process, given that it comes coupled with caffeine almost always in these, a lot of times in these beverages, that problem. And then the poor calorie compensation is another reason that sugar is special. It's about physical activity, it's energy in, energy out. The research most recently suggests that the energy in, the food intake, is more important in understanding why obesity rates are so high than the physical activity. Although it's important to be physically active, they say the science isn't clear. That's not the case, and it only looks unclear when they introduce industry-funded science for the most part. They'll say that people will lose jobs. This is a popular plea to make to the press. The economists really haven't worked this out except industry-funded ones, and my belief is it's sort of a silly argument because if the companies aren't going to sit idly by and just watch consumption of their products go down, they're going to very aggressively promote the products that wouldn't be taxed, like the waters and the juice, etc. And it still takes truck drivers drive those around and people working on an assembly line to bottle them, etc. And finally, they say that the tax would hurt the poor. Now, this is a legitimate argument that it has to be addressed. And my response to it is that the diabetes are regressive diseases that disproportionately hurt the poor, and they are the ones who stand to benefit the most from this public policy option because they're the ones most affected by these diseases, have the least health insurance, and could benefit the most from it. That was clearly the case with tobacco taxes, where the economists have worked it out and find that the people who live in poverty are the ones who have the greatest benefit from in terms of health and lower cost from the tobacco taxes. Also, if the revenues from the taxes are used in a wise way, that is, programs that would disproportionately help the poor, like, say, subsidizing fruits and vegetables or having obesity prevention programs in poor neighborhoods, there are a long list of such things, what one might do, then the revenue that's raised would go back to this group of individuals and help them. The industry, as I said, has aggressively fought this. This is a slide or a picture from New York City where the companies themselves are saying no to the beverage tax. And any of you who are in places where the tax has been proposed will have seen lots of this. Filer will talk about some of this in Philadelphia. The industry created a front group called Americans Against Food Taxes. This strikes me as a high-risk public relations strategy and shows how desperate the industry is. The reason is that the word Americans in the title of this group is pretty ridiculous because it's basically the soda companies and their trade association against food taxes. You go to the About Us thing, it'll talk about citizens, communities, families, and things like that. So this was a bad public relations strategy that the tobacco industry did. They created a variety of front groups with wholesome-sounding names like this. The press got after them, exposed it, and ended up being a public relations liability. So I don't think this will be very effective in the long term, but the industry is doing it. Some of you have seen the advertisements like this one where the family sits down and says, times are tough, we need simple pleasures, and now they're even trying to take away our soda. So they're trying to pull at people's heartstrings by doing this. You look at the lobbying numbers, it's really quite striking. These are numbers from the Los Angeles Times. This is the number of millions of dollars spent lobbying in each of these years by a combination of Coke and Pepsi and their trade association, the American Beverage Association. And you can see what the numbers look like and what happened in 2009, and it'll be interesting to see the 2010 numbers, but they're likely to be very high as well. As far as I can tell, the only organized groups that are opposing a tax on sugar-sweetened beverages are either the industry, their trade associations, their front groups, or their political allies. There's a very long list of what you might consider more objective organizations that are calling for a reduction in sugar-sweetened beverages and or a tax on them. So that would include the CDC, the USDA, Institute of Medicine, and these other groups that you see here, including the World Health Organization. The Centers for Disease Control has made reduction in sugar-sweetened beverages one of the center parts of its platform for addressing the obesity problem nationally. There are a variety of reports on this that give numbers and economic breakdowns and the like that come from a variety of reputable sources. This comes from the Healthy Eating Research Group of the Robert Wood Johnson Foundation and the Bridging the Gap Group. And it's a report on sugar-sweetened beverage taxes. This is the paper that we did on elasticity that I mentioned before. This is a paper that came out in the Bulletin of the World Health Organization within the past month by Boyd Swinburne and his colleagues in Australia about the effect of sugar-sweetened beverage taxes. This report came out from the U.S. Department of Agriculture, and again, it's quite new and recent and up to date. And these all converge on a pretty similar set of conclusions that I'll discuss. The USDA report said that a 20% increase in sugar-sweetened beverages would lead to a decrease in the following ways, and this is about what a penny per ounce tax would do on average. That it would reduce adult calories by 37 per day, adult nationally by 3.8 pounds a year. That's enough to make a public health change. Adult overweight prevalence by 4.5%, and that it would do these things for children. It would even have a greater effect on children than it would on adults. So this strikes me as a pretty positive set of consequences that would be produced by an intervention that brings no cost. So you probably construct lots of ideas of how to deal with the obesity problem, education, changes in schools, on and on, but very few things would have any effect of this magnitude and would cost a huge amount of money. So that's the advantage of a tax. There is a report done by Claire Wong at Columbia University, done by the New York City Department of Health about sugar-sweetened beverage taxes in the state of New York, and their analysis was that a penny per ounce tax would lead to this decrease in consumption, would prevent 37,400 cases of diabetes over 10 years. That's a $1.2 billion savings in healthcare costs, and you can see the other number. And they specifically said that this would create the biggest health benefit for the poor and that it would raise $1 billion in revenue per year. So tax, in my mind, is a home run, even if one doesn't use the revenue in any way related to health or obesity. If you do use some or all of the revenue to help prevent obesity through other programs, then the home run comes a grand slam. At the Rudd Center, we've created a map that you can get to at the web address listed on the bottom of the page of soft drink taxes filed in 2009 and 2010, 17 states, Baltimore, Philadelphia, and Washington, D.C. This is obviously a sign of an increasing trend, and the number is likely to even grow. So while the industry might have some initial victories in fighting these off, it just looks like a matter of time until they start to occur and then spread quickly after that. As I mentioned, at the Rudd Center, we have a variety of resources on this issue that you're welcome to retrieve from our website. One is we have a National Legislative Database, which in addition to the map that I just showed, has a list of every piece of legislation filed around the country on this issue, and it's quite up to date. If you want to see what's happening in other cities and states, the legislative database would be a way to find it. We'll, on our webpage, have the legislative updates available in the place that's circled on the left, and that's a place to get some of this information, including the legislative map. We also have a tax revenue calculator at its website. What this allows a person to do is to put in a city or a state and a level of tax, let's just say a penny per ounce hypothetically, and it will generate a table of estimated income from that, how much a state or a city would make. So it's a little hard to read this, but this would be an example from Texas. So if we put in Texas as the state, a penny per ounce tax, then it creates this kind of a chart. It shows that the revenue would be more than $1 billion a year for Texas if they put in this kind of number. And this can be very helpful for local advocacy groups, state advocacy groups, because it can show how much income can be raised for their particular city or state. And this really catches the attention of legislators because, of course, they can start thinking of lots of ways they might use that money. This is another resource that we have that shows the various organizations in the U.S. and otherwise that support a call for reduction in sugar-sweetened beverage intake or a tax. like to end with talking about framing the issue and the future. First of all, it's important to think about how we talk about the tax in terms of its purpose. And if you can think of its purpose as a means of raising money to pay for something good, then people see a benefit just beyond the reduction in revenue. It's important to always mention the use of revenues so that legislators have their eye on this important goal. Important to make the point that obesity and diabetes are regressive diseases. Burdened food nannies and food police will come up a lot, and the industry will say, who are you to tell us what to eat? And again, it's a legitimate argument, but in fact, the real food police are the food companies. They're the ones that convince people that sugar-sweetened beverages are okay to eat, that products that have fruit in the name don't have to have fruit in them, etc. And in fact, the modern food supply tends to be a very small number of food constituents or ingredients that just get manipulated in a million different ways to create what seems to be choice and variety. The illusion of choice, in fact, if people stop drinking some of these sugar-sweetened beverages and go on to better beverages, we feel that choice and health are increased. Industry self-regulation has failed. The industry says it's making a variety of changes, but consumption of these beverages is still way too high. And in my mind, the industry lobbying is proof that the tax would work. Otherwise, why would the industry care to spend, tens of millions of dollars on lobbying? If it weren't politically feasible, they wouldn't have to fight it. And if it weren't going to have the intended effect on consumption of beverages, they wouldn't have to fight it as well. So I think the lobbying it goes together with all the science to suggest that the tax would certainly work. It's important to set expectations. And my way of framing this is to say that this is really about the most radical proposal that's been made to help address the obesity problem. It's certainly the one that's generated the most consternation from the beverage industry and the other players in the food industry. And the fact that this is now being considered in many as 17 cities and states around the country and countries outside the U.S. shows that people really are taking this obesity problem seriously and are willing to consider something as radical as this. The idea, just like with tobacco taxes, is becoming more normative. When people first introduced tobacco taxes, they seemed crazy. The industry made the argument that they were regressive, that who was government to tell people what to do. Exactly the same arguments are being rolled out now, but tobacco taxes are completely the norm now, and I'm expecting that will happen with these taxes on beverages as well. The industry lobbying simply brings visibility to the problem. Sure, they generate some opposition to the taxes, but there are a lot of people who weren't even thinking about the taxes until the industry started doing all the advertising against them. So I think this is likely to help. The losses, as I said, even bring visibility. So in a place like New York State, where the tax came online, but then the legislature didn't follow through with it, it generated an awful lot of visibility. The idea becomes more normative. The losses are to be expected. They happen with tobacco taxes. They happen with alcohol taxes. So I see no reason at all to be discouraged, not by winning this in the first round. It'll have to go a number of rounds before the victories start to occur. Once the early ones do, then I think there will be this very positive contagion going on. And there's tremendous strength in numbers, so to the extent that cities and states can work together in some coordinated way, I think could be very powerful. So I'll end there, and thank you all for paying attention. I look forward to hearing the rest of the webinar.
That was a great presentation, and I'm going to take all back. So just a couple of reminders. Please continue to submit questions using the Q&A box. We'll be answering those at the end of the webinar, and we'll try to get to as many as possible. Before we move on to Ian, we're going to do a little poll, so I'm going to pass it off on to our poll master, Julia Weinert.
Hi, everyone. Thank you again for joining us today. It's time now to learn more interesting facts about sugar-sweetened beverages. So the poll here in the bottom right corner of your screen in the Q&A box, and you can participate by clicking the answers in that box. For our first question, according to the estimates from a recent USDA study, the one that Kelly mentioned in his presentation, a 20% tax-induced price increase in sugar-sweetened beverages would reduce the average child's weight by how many pounds? The answers are 2 pounds per year, 5 pounds per year, 10 pounds per year, or 15 pounds per year. Go ahead and answer. And the information from this poll comes from the report that Kelly highlighted in his presentation. It's titled Taxing Caloric Sweetened Beverages, Potential Effects on Beverage Consumption, Calorie Intake, and Obesity. And there's a link posted to this article in the chat box, and you can also access this article on the USDA website. So, like most of you have answered, and I'll just give you a few more seconds. Okay, so let's see, 37% of you chose the correct answer. The answer is 5 pounds, so it's a significant reduction in weight. Thanks for participating. I'm going to hand it back to Christine now.
Great, thanks, Julia. And Julia will come back after Ian's presentation for their fact about sugar-sweetened beverage taxes. Now, we're going to hand the microphone over to Ian McLaughlin, staff attorney with NPLAN and Public Health Law and Policy, who will talk about legal considerations for sugar-sweetened beverage taxes. Ian?
Thank you, and good morning and good afternoon, everyone. I hope everyone's enjoying their last few days of summer here, and I'm going to talk a little bit about some of the legal considerations that are involved if you decide to pursue a sugar-sweetened beverage tax, and particularly the legal considerations that are involved in creating a piece of legislation. You can hear the siren in the background. I apologize. That could be the beverage industry coming over to peer in on our webinar. So, as I said, I'm going to talk about some of the legal considerations that are involved when you want to draft a piece of legislation or an ordinance for a sugar-sweetened beverage tax. But before there, I think it's important to step back one step and consider your legal authority for the tax. Ensure that you're on solid legal ground and that you have the authority to levy a tax. And really, your authority depends on whether you're looking at a state-level tax or a tax at the local level of the city or county. As the slide says here, states have really broad authority to tax that's really limited only by a couple of things. One limitation is if there's full preemption or some law that applies that would preempt the tax that you want to enact. And that's relatively rare, and it's not the case for sugar-sweetened beverages. There's no federal preemption. The second on states' authority really are basic constitutional principles that apply to all levels of government action, things like due process and the Commerce Clause and equal protection. So, for example, if you wanted to enact a state-level tax and you only wanted to apply that tax to products that were produced by PepsiCo and not Coca-Cola, you would have a potential constitutional equal protection problem. That's an example, and for the most part, there really are no barriers at the state level for a sugar-sweetened beverage tax. Cities and counties, on the other hand, are really more limited and have no inherent authority to tax. Counties and municipalities in general are limited in their authority that's granted to them by their state. So it's really dependent on your state law. And as I mentioned, there were a few cities this year that seriously pursued a sugar-sweetened beverage tax, and we're going to hear from one city after my presentation. So if you are in a municipality and looking to go down this road, it's important as a first step, I believe, to look at your state law, consult an attorney in your state, and determine whether or not you have the authority for this type of tax at the local level. In research, basically, I think the states can be broken down into a couple of categories. One is the states that have granted relatively broad authority for local governments to enact a certain type of tax, like a business license tax or a gross receipt tax. Based in California, for example, and in states, we believe those kind of taxes could be applied to sugar-sweetened beverages, and the authority is already there. Others are much more limited and have no authority and must get specific authority for each type of tax they want to enact, and it's a lot more difficult in those states. Just as an initial matter, especially if you're working at the city or the county level, I think it's very important to review your state law and determine whether or not you do have the authority for the tax you want to pursue. So if you do have the authority, I want to look at crafting sweetened beverage tax legislation. And I'm going to look primarily at 4 key considerations here. They're listed on the screen: the time amount of the tax, what beverages to include in the tax, level of intervention, meaning who is responsible for paying the tax, finally to earmark the proceeds and how to do so. There's no means an exhaustive list of everything that's in a piece of legislation. There are other very important parts, such as administering the tax and enforcement of provisions and things like that. I'm not going to talk so much about those today because these 4 areas we find are really where policy and law and drafting really come together, and it's important for input from attorneys on this and also from the policymakers and public health professionals. So that's why I'm going to focus on these 4 areas. Of course, as with drafting any piece of legislation, the goal is to be clear enough so that the people who are responsible for paying the tax know what's required of them, know to pay the tax, and know essentially what beverages are included. It's also important that it's clear enough that the government can enforce it as well. So those are something to keep in mind as you're drafting. I do want to highlight one of the resources that we have available here at NPlan. That's a model sugar sweetened beverage tax legislation. We prepared last year, and basically it includes strong provisions from a public health standpoint. Several of the things that Kelly talked about during his presentation are included in our model, such as the default amount of the tax is a penny per ounce, and the proceeds are earmarked, and things like that. It's really a good starting point for creating your own legislation. It's going to be appropriate for every single jurisdiction as is, although you certainly could use it as is, but we think it's a very strong model to start with, and I'm going to be referring back to it as I go through the various considerations on crafting your own tax. So first consideration is what type of tax that do you want to impose? And I have sales taxes on the screen. And sales taxes are really probably most familiar to everybody as the most common type of tax that's applied to products in your state. Almost all states have sales taxes, and as I already mentioned, there are several that a majority of states apply their sales taxes to sugar-sweetened beverages as well. Familiar with basically how sales taxes work, there's a receipt here, and you can see circled on the bottom is the amount of the tax. It's 6%. Sales taxes are usually measured as a percentage of the overall sales price, and here in this state it's 6%. And really there's lots of products that you would buy that are subject to the tax and lots that are not. So here circled above, duct tape is one of the taxable items. It's marked a T. Above it you can see if you can see products, 2-liter bottles are not subject to the tax in this state. So that's basically how sales tax works. There will be a variety of products that are subject to the tax, and at the end of a transaction, there will be a total based on the percentage of overall sales price for those taxable products. Taxes could be a way to raise revenue for public health programs, potentially. That's about its limit for a public health policy. It's not as effective as the next type of tax I'm going to talk about, which is an excise tax, for several reasons. Like I said, sales taxes can certainly raise revenue, but it's difficult to earmark that revenue because it's hard to separate out the earmarked portion. So if you wanted to earmark just the portion of revenue from Coke products or sugar-sweetened beverages, that'd be very difficult to do. Also, it doesn't take into account volume discounts. So as you know, if you buy a large volume of sugar-sweetened beverages, the average price goes down, and therefore the tax rate would effectively be less if you bought a large volume. If you did want to pursue a sales tax on sugar-sweetened beverages in your state, you probably wouldn't need to use most of our model legislation. You could almost always, in most states, amend existing sales tax laws to include sugar. The topic I want to talk about is excise taxes, which we think are much more effective as a public intervention. As your excise taxes are usually imposed on businesses and are often imposed on businesses that sell a particular tangible good. It's a very common tax for specific products, and especially specific products that have some harm or societal effect attached to them, such as tobacco or alcohol or gasoline. Most states impose excise taxes on all of those products. Here, there is a row of cigarettes up on the screen, and the price per pack is up there as well. And one of the reasons why excise taxes can be such an effective public health policy is that it's often incorporated into that shelf price for the product. So unlike a sales tax, we really wouldn't see the tax computation until the actual end of the transaction with the cashier. Excise taxes, especially for things like tobacco, the tax itself is added into the shelf price so that the consumer sees the price increase when the consumer is making the choice. Again, in order to have a public health benefit, the tax rate must be high enough to have that benefit, and Kelly set forth numerous analyses that show that a penny per ounce could have a very positive public health effect, and that's the amount that's included in our model legislation as well. I just want one other way to tax sugar-sweetened beverages if you don't want to go down the per ounce tax side is to something that was done in California this year with two pieces of legislation that were introduced in the state. And that is to apply the tax based on teaspoons of sugar in the beverage rather than the ounce. That's another way to go. And to talk about one other way to go, and not too long, but that's the possibility of imposing a regulatory fee instead of a tax. A regulatory fee is not a tax, but it's actually a fee that's charged on businesses that sell harmful products. And there are some advantages to it. One advantage of a fee is that the proceeds of the fee cannot be used for anything other than mitigating the harms caused by the product. There are some procedural advantages and procedural disadvantages with enacting a fee. I don't want to get into those too much here, except to say that it's really dependent on your state law, and state law with regard to fees has developed differently in different states. In California, our state law has developed to the extent that we think that a regulatory fee is a very viable option for sugar-sweetened beverages. If you'd like information on these, then you can go to our website, phlpnet.org, and see a policy brief that we put together explaining exactly how regulatory fees can be used to combat adverse effects of sugar-sweetened beverages. So the second key consideration in your tax legislation is what beverages are going to be subject to the tax. This is really one of the key policy decisions you can make, and it's probably the one that will generate the most questions from the public and legislators. It's a relatively high-profile decision, and it's not uncommon, for example, to see legislator council members bring in a variety of beverages to a council meeting and put them on the table to show ostensibly, well, some of these are subject to the tax and some are not, and trying to make the point that it might not make sense. Essentially, beverages with added caloric sweeteners of any type are what are associated with increased weight and obesity, and our model legislation includes all sugar-sweetened beverages, any amount of sweetener, and subjects those to the tax. It's not just sodas anymore, as Kelly mentioned. It's a wide array of different sugar-sweetened beverages. You see some of them on the bottom here. And we also think that it's important to include syrups and powders, especially syrups that are used for fountain drinks, which are the largest sugar-sweetened beverages that are sold. Like a model is really broad and includes all sugar-sweetened beverages with any amount of sugar, but there are a variety of ways to customize that definition, and you can take the language and customize it based on what kind of policy outcome you want to pursue, and also the political reality of your jurisdiction. So moving on, the third consideration is what point of intervention for the tax. In other words, who's going to be responsible for paying the tax? If you're going to pursue a sales tax, you are more limited in your options. Essentially, that can only be computed at cashier, and therefore, it's really only feasible at the retail level. The excise, which I mentioned, which is a much better public health tax, we believe, has a lot more points of intervention. It can be levied on wholesalers or distributors or bottlers, and one of the advantages of doing that is that there are fewer wholesalers and distributors and bottlers, and it leads to more effective, efficient collection of the tax. I want to talk for a moment about earmarking the proceeds of the tax. The webinar title is Generating Revenue for Public Health Programs Through Tax, and to do so, it's very important to earmark some of the proceeds, if not all of the proceeds, for the public health programs that you want to fund. Proceeds can obviously just be directed to the general fund of your city or your county or your state and be used for things like road maintenance or whatnot. Proceeds can also be earmarked as a special tax for whatever kind of programs that you can convince your legislature to earmark them for. In this case, it would be a wide variety of public health programs. One example that very prevalent is the fact that a lot of cigarette taxes across the nation are earmarked at least a portion of public health. Here in California, we have a 20-year-old 20 cents per pack cigarette tax. It was enacted in 1988, Prop 99. It was enacted by a ballot initiative by the voters, and a significant portion of that is actually earmarked for health education, assistance, and treatment programs. And it's proved a very effective source of funding for tobacco policy in California, which has been very successful overall. One come up about earmarking of funds is it possible to do so in a way that prevents the legislature later from redirecting those earmarked funds back to the general fund? And the answer is that that's really a little difficult. The way to earmark the funds would be to have the earmarking in the legislation itself. That's very, very important. So there's a part of the legislation, and it's included in our model, that says there's a special fund created, and the proceeds of this tax will be directed to that fund and can only be used for the following purposes. However, doing it that way doesn't prevent a legislature from later on coming back and amending the law to prevent the earmarking. It's a little difficult. It is to have it in the law itself if you can do that, but even that is not bulletproof, and that does not prevent siphoning of the funds later on. One thing that would prevent siphoning of the funds, drawing on Prop 99 example that I talked about, Prop 99 was enacted by ballot initiative, and it created a cigarette tax. And about 5 years after it was enacted, the legislature actually tried in California to redirect some of the earmarked funds to other programs. Well, that led to a lawsuit against the governor by Americans for Non-Smokers' Rights and the American Lung Association, and actually public health failed because a law that's enacted by the voters can't be amended, or the funds cannot be redirected just by legislative act. So in the event that you're able to enact a sugar-sweetened beverage tax through a ballot initiative, then earmarking the funds through that method would be very strong and be very hard to redirect later. If it's done in the legislation itself, it's subject to being redirected at a later time. To earmark the proceeds, then it's good to think broadly all the way from prevention to treatment. There's a list of potential earmarking here, and some states that have the sugar-sweetened beverage taxes on the books that Kelly mentioned do earmark a portion of the proceeds for Medicaid, but it's good also to think broadly about what kind of programs would have the best public health benefit. The four considerations, as Kelly mentioned, there were a number of states in the last year that introduced sugar-sweetened beverage tax legislation, and I want to point to another resource we have here at NPLAN, which is a chart. Similar in some ways to the legislation database that Kelly mentioned, except this is in chart form and compares some of the key components I just talked about from the various bills that were introduced in the last year, including what beverages are subject to the tax, what point of intervention, and those kind of things. Before my time is up, I just want to mention one other policy avenue that we're exploring here, and that's tax incentives. Tax incentives are, I guess, sort of the sister, the cousin to taxes. They're very in our society. They take many forms. They're called tax credits, tax exemptions, deductions, or whatnot. They're a very common tool to incentivize certain behavior. I think the one we're probably almost familiar with is the fact that if you own a home, you can deduct the mortgage interest from your federal income tax, and that's the government essentially saying, we are going to forego collecting some tax that is owed us if you engage in the behavior that we want to incentivize, in this case, buying a home. Or you see the second example there is putting on solar panels. Some states have sales tax holidays, especially around back-to-school time, to prompt people to shop for back-to-school items. Taxes are not talked about in the context of sugar-sweetened beverages very much, because what we're really looking at with the sugar-sweetened beverage tax is trying to disincentivize consumption by raising the price and raise revenue. But tax incentives are potentially a very powerful tool to create healthy retail environments and maybe to reduce the amount of sugar-sweetened beverages that are available in retail stores, and potentially also to increase the amount of healthy beverages that are available, replacing them. So that's a very quick overview. I know that we're a little bit late, so there's my contact information. If anybody has any questions, please contact me offline or use the chat box. Thank you.
Next, we're going to hear from Anna Garcia. Anna is the Senior Policy Associate at the New York Academy of Medicine. She has 15 years experience supporting and advocating for community-based approaches to health at the national, state, and local levels. Her experience includes work with a variety of nonprofit and government organizations, including the Vermont Department of Health, the American Academy of Pediatrics, and the Union of Palestinian Medical Relief Committees in West Bank. Her focus areas for the Academy include chronic disease prevention, enhancing the public health infrastructure, assuring diversity in the healthcare workforce, and child health. We're going to get her presentation up here. Anna, you should be unmuted. You can go.
Thanks, Christine. So let's see. Are the slides coming up?
Second, well.
I'm with the New York Academy of Medicine. We're an independent nonprofit based in New York City that's dedicated to improving the health of people living in cities. And we are also proud to be the new home for New York State's Obesity Prevention Policy Center, which we're called -NY, Designing a Strong and Healthy New York. And let's see, here we have the slides. So we first became involved with the soda tax in 2009. When our state governor proposed a 5-point obesity prevention plan. And in that context, what we had on the table was an 18% sales tax. And as Ian just reviewed, there were some weaknesses to having a sales tax, but we thought in the context of a 5-point plan, it was certainly worth supporting. But the proposal was not very long-lived in 2009. The governor backed down from that in the face of public opposition. In 2010, the proposal was back, and this time we thought it was actually quite a thoughtful tax proposal. This table reviews some of the components of the tax structure. It was a penny per ounce excise tax this time around, based on the Friedman Brownell article. That applied to drinks that were more than 10 calories per 8 ounces, which we thought was also a strategic choice, and that this was a set of beverages that had already been identified by industry as being a problematic category of beverages, and which were going to be removed from schools at Alliance for Healthier Generation initiative. And there's some key exemptions to the tax, such as dairy products, and the tax zeroed in on sugary beverages. Diet drinks and water are not subject to the tax proposal. This was just the first tax, and as you'll see in a later slide, we did have a modification by the end of the legislative session. Once the tax was on the table in January of this year, we in the public health community decided to launch a campaign in support. And so by analyzing the resources that we had available, we decided that a grassroots campaign was not feasible. We have at the bottom of the slide there an example of an ad that was placed by the Alliance for Healthier New York, and that was one example of a mass media attempt that was implemented. But for the most part, what we aimed for was a grass-tops mobilization in terms of trying to identify public health advocates, health professionals, and others that we could mobilize to speak on behalf of the tax. And then we also attempted direct legislator education, and I'll explain each of these strategies in a bit more detail. In terms of a grass top strategy, one of the key things we tried to do was to grow the grass tops as quickly as possible, and we did that through an online petition. From the 2009 experience, we had a group of about 100 individuals and organizations that were interested in supporting the tax. But by creating an online petition fairly early in the season, we were able to collect hundreds and hundreds more signatures. And that was really important when we came to the direct legislator education, to be able to show that we had some base of support for tax. So did sign-on letters and statements of support from key groups like children's organizations and some sort of population-specific groups that we thought legislators would be responsive to. We organized a core group of public health and child advocacy groups and state health departments, the health department and the city health department, to participate in statewide calls to coordinate activities on a regular basis. This shows the core group, and I'll point out that one of the core groups we had was the Service Employees National Union, 1199, and the Greater New York Hospital Association, which was a really interesting ally to work with because they were sort of on an inside track that many of us in public health have not been in the past, and so had the potential to mobilize people on the ground, sort of rallies and other activities that public health organizations are always able to do. So on a monthly basis, something we were able to do was try to build off each other's events and add publicity to things that were ongoing. Commissioner Gaines from the State Health Department, for example, did a really interesting series of YouTube videos, and through our statewide calls, we were able to get other organizations to point to those videos that were available online. Citizens Committee for Children and Center for Science in the Public Interest each did letter narrators. The New York State Healthy Eating and Physical Activity Alliance organized some events. For example, something I thought that was sort of creative that they did was that they hosted a showing of a video at a state legislative building. The video had a Q&A on the impact of sugary beverages, and it was a good awareness-raising exercise for legislative staff that happened to walk by in that building. Alliance for Healthier New York did some soda buybacks, which was also, I thought, rather creative, sort of modeled on the gun buyback model, but sort of encouraged kids to bring in sodas, and they would get a coupon for milk or some other kind of healthy product in exchange for having brought in a soda. And then the Department of Health, and this is definitely worth checking out if you haven't previously, had a Facebook page that is an ongoing page they run, that sort of raising awareness around the health impacts of sugary beverages. It's called Score on the Pound, and they have some really interesting videos if you haven't seen them before. One of our most effective strategies, I think, in building support for the tax was our editorial board meetings and editorials. A number of newspapers across the state ultimately came out in support of the tax, and I think that was quite influential with legislators. We also did, I think, something many people have engaged in the past, which is doing email blasts and action alerts. Educating policymakers, we kicked off the year with a scientific symposium at the Capitol. Dr. Brownell participated along with some other New York State experts to sort of provide the scientific basis for the tax to legislative staff and sort of assure them that this truly is an important and effective public health intervention. We hosted a more traditional lobby day and also did individual meetings with legislators, and we also did a briefing for the Black, Puerto Rican, Hispanic, and Asian Legislative Caucus, which was an important group to discuss the sort of regressive tax charge with directly. They were about that, and I think came away fairly understanding of Dr. Brownell's point about the regressive nature of obesity and diabetes, and not just the tax. Strategy we employed to educate legislators and legislative staff were the use of these weekly factoids, and this is a good way to sort of quickly respond to things that were getting some purchase either in the media or, so just some talk radio, was to, on a weekly basis, put flyers in the boxes of legislative stuff that would address like a single issue. So you see on the right-hand side flyer that the New York State Healthy Eating Physical Activity Alliance did around the idea that New Yorkers would start driving to New Jersey to buy soda if a tax was imposed. This slide summarizes some of the concerns and claims we heard. I think Dr. Brown covered most of these. I thought that something we saw in the ads here from industry was sort of not just that the tax would hurt the poor, but that it was going to hurt the middle class. That seemed to be one of their main claims. Also, something we heard a lot from the public was that their bodega or their corner store doesn't carry low-calorie drinks, and what are you doing about that? So I think those were two important issues we need to pay attention to moving forward. From legislators, their main concern was where's the grassroots support, and I think we need to do more in the future and think strategically about what partners we can work with to demonstrate grassroots support. And I also wanted to know what else we were doing about obesity, so that we weren't just proposing, we weren't just provide cover to the governor for a tax, but that actually this is a serious public health intervention. So the budget process this year was exceptionally, I think, dysfunctional and difficult. That it was due April 1st, and it dragged on until about August. Sometime in May, the governor added a modification to the tax proposal, which was that beverages that were low calorie would become sales tax exempt. So not only would they be free from the tax that was being proposed, they would also be sales tax exempt, and there would be an even greater differential between low calorie drinks and high calorie drinks. And to some extent, it was proposed as sort of a way of saying industry will still have plenty of things to market. We're not trying to tie their hands. And it was also a response to the idea that this is a regressive tax by making cheap drinks, calorie drinks even cheaper, than people who have low income will have more options. The proposal, I think, was interesting and good, but came late in the game, and ultimately we did not prevail with the soda tax. But we definitely got a very heated conversation going across the state and raised a lot of awareness around the impact that sugary beverages are having on people's lives. For next year, some of the things we're going to be considering are whether, in terms of phrasing or shaping our campaign, will be whether the new governor is going to include a tax in his budget proposal. Governor Newsom did it for the last 2 years, but we're not sure what our new governor will have in mind, and whether or not it's included in the budget proposal will tell us whether we need to frame our campaign around the budget process or perhaps around a standalone legislative proposal further on in the year. We'll also want to see what other revenue measures are proposed. That may sort of indicate other allies we might have for the sugar beverage tax, if perhaps other industries are being identified as the sources of revenue. And discuss the issue of revenue is quite important. There's a lot more support for the tax if there's a way to say that the tax is going to go toward obesity prevention, but that's a very difficult process for New York State, and apparently it's quite difficult to protect the revenue from being rated for the general fund. And the final consideration, which we're quite excited about, is the potential for a New York City pilot. This is, if it's possible for part of the state to try the tax for a while, and inform the rest of the state about its effectiveness and revenue potential, perhaps that's something that Albany will be a little bit more amenable to. So we'll see. Create a website at the Academy of Medicine to archive the information that was being collected, the articles that were being generated, the factoids, and those are all available at sugarsweetenedbeverages.org. You can also contact me directly if you have any questions or would like to see any tools that we developed during our campaign. My email is on the screen.
All right, thank you, Anna, for sharing the lessons from New York State. So we're going to continue on this theme and hear from Nan Filer of Philadelphia. Nan was appointed Chief of staff of the Department of Public Health in Philadelphia, Pennsylvania in April of 2008. She oversees programs devoted to maternal and child health, chronic disease prevention, childhood lead poisoning prevention, disease surveillance and control, environmental management services, and air quality management. Prior to being government service, Ms. Filer spent over 20 years in the nonprofit sector as a lawyer and agency director. Most recently, she was the executive director of Nationalities Service Center, a multicultural, multilingual nonprofit agency that provides legal and social services and English as a second language classes to the Philadelphia region's immigrant and refugee population. And then you are unmuted. Yep, I can hear you, and I'm going to pass the slides over to you.
Okay. Thank you very much. I'm just looking at my first webinar panel presentation, making sure I have the right buttons. I'm pleased to be with you today, really to talk about our experience as a city taking on the issue of reducing obesity and with one strategy, including a sugar-sweetened beverage tax. What I really do is just take you through our effort and share with you a little bit about the lessons we learned. And sorry, I am having trouble getting to the next slide. There you go. Can you see it? Can you hear me?
Yep, we can see it.
Okay. Can you hear me? Thank you. Our partners, I think one of the reasons why we were as successful as we were, although we did not in the 11th hour get the final vote we need from City Council to pass it, was because of our mayor, Michael Nutter, was a real champion of the tax, I think based partly on his concern for public health, but also building on his experience over many years working to get our Clean Air Act passed. Also the Food Trust, a local nonprofit you may know about, an individual from American Heart Association and Save the Children campaign for healthy kids, very helpful and being our nonprofit partners. The strategy basically, and I think one of the points I want to make is that our effort was really very action-packed. It was a short period of time, and we had no time to build really any public support before the tax was introduced. In fact, I was thinking, when you talked about your revenue calculator, that was kind of in part what inspired our mayor to want to look at a sugar-sweetened beverage tax in light of our efforts trying to get a balanced budget. So the genesis of the tax was revenue, was for revenue with $20 million of the estimated revenue going towards obesity prevention. So there were really two messages when we did our public speaking and worked with the media, that this absolutely was for revenue, to generate revenue with a strong link to obesity prevention. So on February 3rd was when City Council first learned about our bill. It was going before City Council as part of the budget. There was a hearing we held on the problem of obesity to try to educate City Council. Then several of us in there met with soda industry and actually supermarket, grocery store industry reps. The opposition got fairly heated up quickly, and on March 24th, as just one effort of what they did, of what particularly the Teamsters, American Beverage Association Act, opponents held a rally, and there were big signs, as Kelly showed, on all the trucks, and in fact on all the soda machines throughout city government. There was an important event where Save the Children had funded a public opinion poll, which I'll talk about in a second, that helped at least one effort to defeat the tax. On May 18th, you may have even heard about this. We got quite a bit of publicity because the day before, or 2 days before, the City Council was actually going to vote on whether the budget would include the soda tax. Harold Honigman, who is a local businessman, and he was described in the press as a beverage mogul, very wealthy individual and that has supported a lot of nonprofits and the mayor's campaign, and is a bottler, offered City Council $10 million to pay for efforts around obesity prevention with expectation, I I think, that City Council would vote against the bill. And May 20th, the actual bill was defeated, although only by one vote. Tax, at the time when our lawyers worked on the tax, we were not really able at that point to create a mechanism for an excise tax, as Ian spoke of, so which I think is by far a more preferable structure. But as Ian said, there's some complications with having a local jurisdiction create a tax. At the time, we proposed a 2-cent per ounce tax, but it would be kind of like a business privilege tax. That is, it would be levied on Philadelphia retailers based on their annual volume of sales. So it was almost retroactive in that at the end of the year, the retailer would take all the receipts for selling sugar-sweetened beverages and pay a tax on the amount that was sold. So we couldn't guarantee that it would necessarily impact the price, because the retailer could spread the price around a different way. And that was one of the challenges in talking to folks about the law. It was both complicated and hard to assure folks that it would affect the price of soda. We define sugar-sweetened beverage, as you can see, non-alcoholic beverage. It was a fairly complete list of sodas, of sports drinks, and sweetened tea. Our public messaging, and some of us went to many community meetings to talk about this in our short period of time, and that's I've got a lot of my anecdotal experience of how people reacted, but also as we talked about it in the press, was really twofold, as I said. It to raise revenue to protect city services, and that was an important message that we didn't shy away from as our libraries, rec centers, and other essential services faced cuts. But in fact, it was linked to the obesity epidemic in two ways. It would create $20 million in funding for the Department of Public Health's efforts, and we hoped reduce the amount of sugar-sweetened beverages that folks drink by impacting the price. I'll talk a little bit about that challenge. Incidentally, legally, we are not able to earmark. The City Council can't earmark funds, so we couldn't guarantee that $20 million would go to the Health Department, but that was the expectation, and certainly there was going to be language. I'm not sure if it would be in the bill or from discussions in City Council that the money would be earmarked. It was important that we could talk to folks about what that money would do, and it responds to the regressive nature of the tax, I think, in terms of the services that we would want to promote in low-income neighborhoods, and also to make our strategies concrete. So we did try to get our message across how the money would be used, and in particular, and we have CPPW money that we're investing this as well, as to increase access to healthy foods, decrease availability and consumption of unhealthy foods, for example, in schools and in rec centers, et cetera, and to promote physical activity. I kind of pulled together our talking points just because of shortness of time, but we have lots more information if any of you are interested in learning from what we did. I think these are some of the most important talking points to make, that this is taxing the, and this I think supports what you've already heard. Taxing is part of a campaign to reduce obesity, that obesity is an increasingly serious concern in Philadelphia, and in particular impacts low-income communities of color. The serious health impacts of being overweight and obese, that the marketing targets low-income families, and the revenue will provide services to low-income families. And as Ellie said, we would get lots of questions about why soda, not all junk food. What I found in particular very helpful when I went to community meetings was that we had a lot of mapping, and I would encourage you to think about how to make the health crisis of obesity, really how to illustrate that as much as you can. And I didn't include these slides, but I have lots of maps about both the prevalence of obesity in our different neighborhoods, but also the prevalence of many obesity-related health conditions. And go talk to neighborhoods, I would actually talk about the rate of diabetes or the rate of obesity in their neighborhoods. And to underscore the racial and ethnic disparities in some neighborhoods, particularly in North Philly, which is primarily African American and Latino, 70% of kids are overweight or obese. City, 64% of our adults are overweight and obese, and 57% of kids. So I think it was really important to help at least people start dialogue about why is this and what can be done, and particularly what's the role of soda. The using arguments pretty consistent with what you've heard, that this actually reduce obesity, that soda is not the problem, the solution is education, the tax will hurt the economy and cost jobs, and it's unfair. I think touched about many of them. The one that I think that industry pressed hardest on was that it would cost jobs, and created a campaign, Philly Jobs Not Taxes. SavePhillyJobs.com is their website. This is a photo from the rally I mentioned against the tax. And while we have a lot of time or funding, we did come up with our own kind of counter advertisement where we had a soda can that said obesity with a catchy slogan. And you'll notice here this says Philly Jobs Not Taxes. So we said health because kids matter. So we do at least get some counter advertising out. At the time, as I mentioned, the Campaign for Healthy Kids did a poll, and I think that this was an important piece of effort, and it found 55% of likely Philadelphia voters would support taxation of 2 cents per ounce if the thing was dedicated. There's lots of other information in that poll I'd be happy to share. Just briefly, 87% expressed a concern about rates of obesity. More than 6 in 10 voters supported increasing availability of fresh fruits and vegetables. Among the other suggested methods to reduce the city's shortfall, remember that was the context this was in, sugar-sweetened beverage tax was the most popular. I mean, here, high standard, but we were pleased that people did recognize some of the problems. We tried to work with both our local media, and at first I think there was kind of more mixed coverage, and our op-ed pieces, I think Kel might have had one, were published. I should say, and as a side, in our obesity hearings, and I mentioned this because he also wrote an op-ed piece, one of colleagues who is himself obese testified about how his life was shaped really by access to fast food, not having much money, drinking soda, and the challenges of being obese, and an op-ed piece. And I think he certainly, I think, felt very good about that effort, and I think it was really important in the hearing for people to hear from someone who himself is obese and what their struggle has been like. In any case, by the end of May, however, the Inquirer, our main newspaper, came out with an editorial that basically, what they said was that the City Council should stand firm against the mayor's proposed tax on sweet drinks, the beverage industry, it says, but that it's simply a revenue generator for a town that refuses to live within its means. So they go on to say that the tax is unlikely to significantly improve public health. I think really a lot of the fight came down to, was City Council going to support what the mayor wanted in balancing the budget, when shouldn't the city be cutting its fat? I guess link right there. So although the editorial did end, that said, it's sickening to see the beverage industry try to buy its way out of the soda drink tax. Our current efforts, right now we are continuing to focus a lot on efforts to reduce soda consumption as part of our efforts to reduce obesity and increase access to healthy living. We're working with media firms, and we'll be launching a fairly major media campaign in January. Also, we were able to retain Annenberg Public Policy Center of University of Pennsylvania to do a survey to really get a sense of people's attitudes and beliefs around 2 issues. One is sugar-sweetened beverage consumption, particularly at mealtime. The other is TV watching. I did include just a few of the insights that I think we gained from this survey. In Philadelphia, this was, about 119 people, and I think evidently a very scientifically sound study. Adults and children drink an average of 2 sugar-sweetened beverages a day. Children with a lot of say in their household beverage purchases are more likely to be heavy soda drinkers. I think that's an important point to make that surprised me, just FY, as you're working on different strategies, that a parent claimed, this was the survey of caregivers of children, and the majority felt like their kids didn't make decisions about what to drink at meal times, but did make decisions about what to purchase in the grocery store. And one, the family purchased it because the kid wanted the soda or whatever. Then that kid was more likely to drink. So they have something, we might want to think about that in terms of both policy and media. And the survey showed that there's a lot of sugar-sweetened beverages in Philadelphia homes and consumed at meal times. When we ask people their beliefs about causes of being overweight, you'll see that 70% said that drinking sugar-sweetened soda was a factor, along with all the other factors you can see. I want to have time for questions, so let me finish up with sort of our learned. I think that if it's very important to structure the tax to impact price if you can. That was really a challenge for us, and I think in local jurisdictions you may have some of our challenges, although we're definitely re-looking at it and an excise tax is possible. We can talk more offline if you're interested in what the challenges were. I think it's very important, as people have said, that your education and your advocacy focuses on the health problems of obesity and links it to soda, that sugar-sweetened beverages are bad for families and for kids. I said when I did public speaking anyway, it was very helpful to make it personal, relevant to neighborhoods. It's so important to focus on what the tax will fund. Build community support and spokespeople, I think, probably goes without saying. It isn't something that, as I said, we had time to do, but certainly something we're very interested in. New York clearly, did a great job with that. Don't underestimate the opposition. And it did feel like there were about 5 of us against this incredibly huge, well-funded soda industry. So that we lost by 1 vote wasn't bad. Everything is political, and that may be, in fact, why we lost by 1 vote. And keep trying. And I guess that sort of, I'll end there because it's sort of, I think, a positive way to end, as Kelly ended, that I think a lot of this is about normative change, and I think that the campaign is really part of that, whether or not the tax is passed. And I just wanted to share that in the Annenberg study, which was done after our campaign, 50% of the heads of households had heard on the media or a campaign to reduce consumption of sugar-sweetened beverages. I think that's a good starting point. They didn't really know necessarily where they learned that from, except that 4% said they learned that drinking soda was bad because of the campaign to get a soda tax. So that's a start.
All right, Nan. It's a great presentation. So I'm going to take a couple of questions. We are running a little bit over time, so if you have time, please stick around a couple minutes, everyone. And all the panelists are unmuted. So the first question, just to jump right in, several people, this one's for Kelly Brownell, several people have been asking about the regressivity argument. So Kelly, could you say a little bit more about why you think the claim of regressivity is false?
Well, one of the reasons that I didn't bring up was that the regressive tax has become a special problem when you're taxing something that people need, like, let's say, gasoline, or if it were some necessary food. But sugar-sweetened beverages certainly aren't necessary, and we did a little quick calculation figuring that an average family of 4 could save somewhere between $3,000 and $4,000 a year by switching from sugar-sweetened beverages just to tap water. So anything to help encourage that change in the population in general would be welcome from a public health point of view. And then because that population suffers from the highest risk for diabetes and obesity, there would be the greatest healthcare savings in those individuals. And then also, as I said, if the revenue were used to help fund programs that would especially help the poor, that would be of great benefit to them. My favorite would be to subsidize fruits and vegetables, but anything that would help people in poor circumstances would be a good thing.
Thank you. The next question I'll give to Ian. One person in the audience is from a state that's thinking about changing the tax-exempt status of sugar-sweetened beverages. Could you say a little bit about that strategy?
Sure. What we've been talking about this whole webinar has really been creating specific tax regimes that apply only to sugar-sweetened beverages with earmarked proceeds and so forth. But another tack to take, and in fact several states this year introduced legislation to do this, would be to remove the exemption for sugar-sweetened beverages from the state sales tax law. I believe Colorado passed a law to that effect this year in 2010. And as I think I touched upon, that's really a lot simpler in many ways, because if you're in a state that has an existing sales tax and you currently exempt sugar-sweetened beverages or other foods, you could have a bill that just removed that exemption. I don't see any legal problems with that, aside from the public health issues that I talked about. It's more difficult to earmark the proceeds and so forth, but the legislation itself to remove the exemption would not be legally too difficult, I believe.
All right, thank you. And one last question before we wrap up. I'll pass this one to Anna or Nan. Several people asked about relationships with the oral health community, dentists, that sort of thing. Did either of you work with advocates from that community?
Anna in Philadelphia, we actually didn't in the first round, although there were some dental associations that actually on their own contacted us and wrote letters to a city council. But I think it is an important, both pediatricians as well as dental professionals, I think, would be a very important spokespeople.
We did work with the dentists, the dental hygienists, trying to remember who else. So we recognized early on that oral hygiene would be a really good sector to work with.
All right. Well, unfortunately, we're out of time, but thank you to all of the panelists for sharing your wisdom and expertise with the audience. NPLAN does not have another webinar scheduled for the fall, but our colleagues at Public Health Law and Policy do have a Healthy Corner Store webinar scheduled for December, so please do check that out if you're interested. We'll be sending out an email tomorrow with an evaluation survey for the webinar and a link to the presentation materials and the recording on our website, so please do keep an eye out for that. And with that, thank you for joining us.